We are at the renowned Watson Clinic in Lakeland, and I'm here with Dr. Elizabeth DuPont. She is Breast Health Services Medical Director here. We're having a great conversation. I want to bring you in on it. And Doctor, first thing I want to find out is some of the myths surrounding breast health, especially breast cancer prevention and diagnosis. I mean, there's everything from people believing if you wear underwire bras or wear deodorant, that's going to cause it, or then who's more susceptible. What myths can you share with us?
Well, there are very many of them. One of them is that a mammogram causes breast cancer. You get less radiation with a mammogram than you do from flying from New York to LA. It doesn't cause breast cancer. It also doesn't prevent breast cancer. It finds it as early as possible. And that's the benefit of the mammogram. Another one is that men don't get breast cancer. I saw 3 men in this past month with a breast problem, and 2 of them had breast cancer. So yes, you do see men with breast cancer.
Dr. DuPont, one myth I thought was very interesting is that there aren't things that you can do to make sure that your chances go down of getting breast cancer, but there are things you can do to prevent it, basically.
There are things you can do to minimize your risk. For example, exercise. Exercise is hugely important in minimizing your risk. Those women who do not exercise have a 20 to 40% higher risk of breast cancer. And diet does help in the weight loss category because a lot of breast cancer is estrogen fed, and our fat cells metabolize into estrogen, sadly. So yes, you can dial down your risk of breast cancer.
What if you've had a mastectomy? Are you able to get breast cancer after that?
Unfortunately, yes, you are. And the risk is not that much less than with a lumpectomy, because as long as you've got skin, you've got breast cells. You cannot completely get rid of all the breast cells. So there is still a risk. It's about 3%, but we see it every year with women who have had bilateral mastectomy and they have another breast cancer.
And what about when you get that diagnosis? As scary as it is, you start to attack it really from 2 approaches, local and systemic.
Correct. You need both therapies. Systemic therapies for the whole body. Yes, we care about the breast. That's local therapy, that's surgery and maybe radiation. But the systemic therapy is for the body to help you not get it anywhere else. And that's very important. It can be the anti-estrogen pill, it can be immunotherapy, it can be chemotherapy, but it is very important.
Now, what about treatment after, I should say, these oncoplastic treatments where you're taking in mind the cosmetic side of things after your oncology treatments?
Yeah, we look at that as breast surgeons. We worry about the cosmetic result. We want the lady to look as good as possible, the gentleman as well. And we also want to minimize the hard effects of a mammogram afterwards, because if the breast is scarred down, is sunken in, which you might get with a very big lumpectomy, you go to get your mammogram and it's very difficult to get a good picture. It's hard on the patient, it's hard on the technologist. So we do work with plastic surgeons or individually to try to rearrange the breast and fill in that defect to avoid that problem.
We want to give you the information so you can take a look on the screen, and you can find out more when you visit Watson Clinic online, of course. And Dr. DuPont, I know you're beloved in this health community, and I can certainly see why. Thanks for taking care of the community.
Oh, it's my privilege. Thank you so much.